Greetings, you beautiful people. I'm Nojali Shongwe and welcome to Style Up, a chat room created and powered by AHF Eswatini to discuss health and social related issues in an effort to empower the youth to lead a safer and healthier tomorrow. The topic at hand today is teenage pregnancy, and our guest is a representative from the Ministry of Health who works within the SRH program, Lindiwe Malaza. Ms. Lindiwe, welcome to Style Up.
Thank you for having me. I'm happy to be here to discuss youth issues. Thank you.
So, Ms. Malaza, teenage pregnancy is not a new challenge to be faced by the youth of Eswatini. How would you define the situation in recent times, as unconfirmed reports actually state that the rates are higher than before?
Teenage pregnancy has, over the years, been a problem, and surveys has confirmed that. And currently we're standing at 16.7 teenage pregnancy rates in the country. And but recently, the COVID-19 pandemic has actually made things worse. We've noted that through health facility reports that are actually reporting that the young people, the teenagers, are actually coming to the health facilities for antenatal care, first antenatal care services. And we are actually seeing the ages going lower and lower. One health facility actually reported that a 13-year-old came to the health facility for antenatal care services, meaning that she's pregnant. And we understand that the lockdown could have been a reason, because schools were closed and the kids were actually staying at home, and for some reason pregnancy kicked in.
Interesting that you mention the relationship between the COVID-19 pandemic and its contribution to the increase in rates. We would like to know what sort of policies that the Government of Eswatini has actually put in place to combat the increased rates of teenage pregnancy.
Okay, there's a lot that the Ministry of Health has done, and the government, and with the support from different organizations such as AHF, different organizations working with the youth in the country, the adolescent SRH guidelines, the SRH policy, the Children's Protection and Welfare Act of 2012 has actually, it's actually making the environment to be, easy to work with, and ensuring that the young people have information, the young people have access to SRH and HIV information and services. And we've trained our health facilities, we've trained our nurses, we encourage them to be youth-friendly. And we also go to the communities to talk, with the organizations that support us, to talk to the young people actually about these issues, SRH and HIV issues, and how they can reduce or stop these unwanted pregnancies, the teenage pregnancies. And there's a lot that we've done. And we do encourage young people to access information from all the platforms that we have in the country. And our nurses are always willing, nurses and doctors are always willing to give information and services to these young people so that we can reduce these rates as low as we can.
Ms. Malaza, thank you so much for that information. It's actually beautiful to hear that you guys encourage healthcare workers to be friendly, and this creates a safe environment for the teenagers to actually go and seek professional help instead of them being judged. So there you have it, beautiful people. We have more information coming up. Remember to stay woke, stay safe, and style up.
Right.
Welcome back, you beautiful people, to the Style Up chat room powered by AHF Eswatini. The topic at hand is teenage pregnancy, and our guest is Ms. Lindiwe Malaza from the Ministry of Health. Interesting that you mentioned the policies put in place by the government and all their efforts to actually create a safe space for the youth, and especially the girl child, to seek professional help. However, I do believe that adolescents have a role to play in this. And what advice would you actually give them to discourage them from falling pregnant at a tender age?
First and foremost, I would say the government encourages, it's in us as a Maswati that we encourage abstinence. Abstinence is the word. all platforms. Actually, in Eswatini, we encourage all adolescents to delay sex debut and ensure ukuthi achieve everything I achieve it before she actually engages into sexual intercourse. Because once you start that, there's so many responsibilities attached.
Absolutely.
And we preach that gospel, the ministry and all the organizations involved. We want them to know that it's still important to maintain your virginity as long as you can, delay your sex debut, and seek information on the advantages of delaying. And then for one young person who feels like, I feel like I want to start, our hands are open. We want you to come to us. We want you to seek for the information and uyithole before you actually engage yourself into the act. So plan na kuyenda. And I like the gama lithi planning, because once you plan something, before you actually do it, you find yourself in a best position to decide whether uqhubeke or not. And we want them to come to other health facilities. Organizations are there in the communities, and the youth friendliness, the healthcare workers and all. We are there to say, guys, buyani, because just maybe we've run the race, we understand the implications around it, and before ingodo yengcindlela, we want you to understand and come to us, because that's another way, and be responsible. Once you come to us, sikunikete information, we want you to take this information and run with it. Know that once you are a girl, you've started your menstrual cycles, and you are a boy, you've had your wet dreams. What does that mean? That is a definite start of everything. And then, should you engage into sexual intercourse, these are the possibilities. We'll give you every information that you need. And we'll ensure that we walk with you, because you need your hand to be held. Absolutely. So that you do not find yourself in a situation whereby you cannot reverse the situation. So we are saying, information. I will make an example of one who says, I think I want to start having sex, of which as adults, we like, please delay, please abstain, but we want you to come to us, and then it's okay, you know what? Once you decide to do what you want to do, start sexual intercourse, there's a possibility of you getting HIV, there's a possibility of you getting sexually transmitted infection, and of course there's a possibility of you falling pregnant. And what does that mean to your young body? What does it mean to your brain? What does it mean to your future plans? Because we believe that every young person has plans. And then there's everything there. I mean, we've got the family planning methods. We've got the pill, the injectable, we've got the implants, and we've got the intrauterine contraceptive device known as the loop. And we've got the condom, which has an ability to provide triple protection. You'll be protected from teenage pregnancy, unplanned pregnancy, like HIV infection, STIs and all. We will give you that information. And trust me, from experience, sitting down with young people who are responsible enough to come to the healthcare worker and get this information, most of them would say, yo, Ms. Malaza, I actually was thinking because of peer pressure, maybe my boyfriend was pressurizing me, I'm thinking of let me just delay. And we also encourage that. So we want these young people to be responsible, because everything is set for them, everything is in place. But really, we can have this information, we can have these services, but if they do not come to us to seek these services, then the situation will be the issue at hand, teenage pregnancy, which is actually killing the country, because young people, you guys are the future of the country, and we cannot do it if you guys ningas bambis.
Sure. Ms. Malaza, thank you so much for the gems that you dropped, and to the youth at home, I hope you were really, really attentive and that you actually make use of all this information. And remember, we actually do have youth-friendly healthcare professionals. Moving right along, Ms. Malaza, I would like for us to discuss one last question. We noted that in recent times, the government of Eswatini, especially during the COVID-19 era, is willing to allow pregnant teens to return to school. Yet this was not the case before. Before you could not actually go back to school while pregnant. What are your thoughts on this?
It's interesting that you actually asked me that, and my thoughts are, it's simple. Le ndlela le ngiyibuka ngayo mina ngingilindwe malaza ngisebenza etikweni letempilo ukuthi COVID-19 pandemic has brought so many changes in our lifestyle and has brought so many challenges, and the way we used to do things, it looks like we are pushed by the pandemic to change the way we do things, the way we think.
Absolutely.
And to sort of readjust to the status quo, because there's so much at stake. I will talk from a perspective of MOH, being an MOH employee, a government employee, and also talk from being a parent as well, and somebody who is in the community and looking at these issues as well, and considering Minister of Education situation as well. There's so many things to readjust. There's a young person, there's a teenager who had a bright future, who had so many plans and had calculated. And before she knew, the COVID-19 came and lockdown came, and for some reason she found herself pregnant. And the education system has been affected, teachers have been affected, and everyone else is not sure how to handle this. And it's time we sit down as different parties into the system, sibugele maybe the economy, sibugele the future, because we are saying adolescents, the teenagers are the future of Eswatini, so we need to consider all aspects. I would say from MOH perspective, we do not want to have maternal mortality rates increasing. You know, it's a pity once we because so we do not want you to die due to the pregnancy. So we need to consider your welfare. But at the same time, the Minister of Education, Training and Education is considering, guys, I'm a teacher first, before I'm supposed to be pushed to be like taking care of a pregnant woman, a pregnant teenager. We know that pregnancy brings so many issues. I mean, there's issues of ill health, you know, anything is possible. And remember, this is a teenager who's pregnant, and anything is possible. She can start going on labor during the class session, and a teacher has to be, you know, accommodated into the whole sphere. So it's time we sit down and consider all these things. And there's the economy as well. There's the future of this young person. We're talking about girl empowerment. And itolo, begun normal, I would say, you go back home, raise the child. But namuhla, siyabona maybe government utsite, bantwana babuyela esikolweni. Pregnant, but kunema issues nalomvana we should consider I mean, some are even saying going back to the same school. They have been talking to issues of me not falling pregnant, and so teacher Jilo already, I mean, she messed up, I would say that. She's pregnant, she's bangan back, she's not sure whether she's still a young person or not. How will the friends and the teachers say, how would she be treated into the whole environment? So there's so much to be considered here. So it's time we go back to the drawing board, consider all these things, pass and find, you know, lilayini to accommodate sonke lesimo. Asifuni kushonelwa ngilabantwana labatetfele, but at the same time asifuni kuthwesa thishela simo langeke akhone kusisita, but at the same time asifuni lo mfana ethu le teenager lethu ukuthi aluze lukusasa lakhe because of this pregnancy. So mine would say, you ask me what's in my personal opinion, mine would say let's continue the talk, let's continue the discussion. But I would strongly suggest and say to the young person at home, had you listened, had you understood the situation around, had you made use of everything. I'm not actually blaming the young person here, but I'm saying we have discussed it earlier. Everything is in there. You know, youth friendliness, health facilities, healthcare workers are trained to be youth friendly. Services and information is there. We wouldn't be here talking about should a pregnant teenager go back to school or not. So there is a responsibility from the part of the government, Ministry of Health, there's a responsibility from the part of Ministry of Education and Training. There's also a responsibility from the parent, the community, and especially the adolescents themselves, the young people. So asibambisane in order to reduce these issues, because wonke uyayikhuluma le ndzaba yakhe ivakale. Ministry of Health uthi we do not want to have pregnant women dying because of pregnancy or labor and delivery. Minister of Education naye akafuni ukuthi simithele bantfu labasha, but naye uthi asifuni alose, because the future of the country or the economy of the country is highly reliant on a young person, on a teenager, on a girl, on a boy, you know, having a bright future. So we need to balance these things and put everything in place. Akube konke kube in place, understand it, because na tishelo yamuva, ngoba na tishelo uthi ha masekahelwa le. When labor starts, what do I do? The Ministry of Health ithi angifuni kufelwa makelo tetfele. So we need to balance these things, and I will go back to saying abstinence, and I'll go back to say, guys, everything is there for you to access. There's information and there's services. You can do something to reduce the situation and come to a situation whereby asingumdani, because ngiyabona ukuthi lana sigcina singakayitholi isolution, but asibambisane. Everyone has a part to play, and I believe if we all have a part to play and discuss this and find a way, we will find an amicable solution to the whole situation. And the young person is responsible, has a responsibility. She has a right to education.
Absolutely.
But at the same time, she has a right, she has a responsibility to play into the whole sphere. Asibambise, because mabanga asibambise bamflabasha, we might lose this game, and that becomes a silly because soon we'll be retiring. We want to hand over the baton to you guys so that you carry the country through to the next level.
Precisely. Thank you so much, Ms. Malaza. Remember, you're responsible for your future, and we need to work with the government and not blame anyone for not knowing better, because she just shared so much words of wisdom. To our viewers, thank you so much for tuning in. Please do like, comment, share, and subscribe if you haven't already, and we look forward to having you back here for the next episode. In the meantime, stay safe, stay woke,